Pharmacy Guild so critical of the fact that pharmacists haven't been used in the vaccine rollout. You deal with customers and patients every day, don't you, in terms of trying to ease their hesitancy? It'd be a lot easier if you could go into your clinic and just say, here's the vaccine, let's do it now.
Absolutely. I'm having, tens of conversations a day with people that are like, hey, what's the deal with this? I'm a little bit unsure. People are really happy once they've spoken to a health professional, they know whether it be their GP or the pharmacist. We can kind of help work through that hesitancy with them. And majority of the conversations I've had, people are like, oh, cool, all right, well, that sort of makes sense. And I'm happy to get vaccinated now, but how do I actually do that? And particularly here in regional Victoria, it's not that sort of simple. And I've got an empty clinic room just waiting to be able to vaccinate people.
Yeah, well, that's the thing, isn't it, Lauren? You and pharmacists right around the country have already shown you're capable. I mean, we've all been into the pharmacist for a flu jab and so on. You know what you're doing.
Yeah, absolutely. And there's, more studies coming out now as well, looking specifically at pharmacy-related flu vaccines and showing that actually people are having less side effects with flu-based vaccines in pharmacy. So why are there, almost 4,000 clinic rooms around Australia sitting, waiting to be given the opportunity to help with the COVID vaccine rollout? It's absolute madness.
And it's somewhere like, as you said, Bacchus Marsh, the closest hub to you, it'd be quite a drive away, wouldn't it, to go and get the vaccine?
Yeah, the reality is that there are a couple of local GP clinics that are part of the vaccine rollout already, but their waiting lists are massive. They're not being given enough vaccines to keep up with demand. And so the next option for people is to go to a hub. Well, the next hub is Ballarat or Sunshine, which is Sunshine towards what was a hotspot sort of recently, 35 minutes one way or 45 another. People aren't wanting to have to travel that far, and they shouldn't have to as well. They've got probably a community pharmacy 1.5 k's down the road. Why can't they walk in here, and why can't they also have greater access at GP clinics? We should be absolutely expanding the access.
Indeed. And that point that you made earlier, Lauren, I think is a potent one, because if someone's going into the chemist or the pharmacist to get, some Panadol or something else, daily product that they might use, they should be able to have the opportunity to get a jab as well, to make it easy for those that might be wavering.
Yeah, absolutely. I mean, we are talking about vaccine hesitancy and that sort of thing, but I think people are a lot less hesitant about the vaccines themselves once they understand how to access. So, why are people having to travel so far? We have so many pharmacies that are ready and willing, and we just need to make it easier for people to access. And realistically, the government probably should have realised that 2 months ago when we had empty hubs, particularly in Victoria, and then all of a sudden when we had another lockdown looming, those hubs were overrun because people were finally thinking, oh, well, maybe that 45-minute drive is worth it. But we have so many ready and willing, and they're just not being mobilised, and it's absolutely ridiculous. Yeah,
well, that's the thing as well. Pharmacists are trusted. You know the people, they know you, and so you're finding, Lauren, that hesitancy does dwindle when people are in there, and you can have a chat. But then you need to be able to give them the jab.
Yeah, absolutely. And people like that friendly face. They like, hey, you've been my local community pharmacist for 18 months now. I've gotten to know you really well, and I trust you, and I trust your opinion. And people want to be able to deal with people they know rather than having to drive so far to get it. We just need to make it easier for them.
And, well, that's the point, isn't it, as well? It's the familiarity, but it's the ease as well, the ease of doing it, just as normal part of your life. You don't have to have half the day off of work to go and do it.
No. Yeah, I'd love to be able to say, yeah, sure, here you go, can I book you in right now? And we'll book your second dose while you're here. Like, that would be so much easier.